Howdy and welcome to the Confidence Through Health podcast. I'm Jerry Snyder. As an elite level athlete, owner of All In Health and Wellness, and author of the book Confidence Through Health, my goal is to help you achieve your goals and dreams using health as the conduit to get there. So I want to take a second to thank our sponsor for this episode, American Sports and Fitness Association. They are the place to go for your personal trainer and fitness certifications. They have a wide range of certifications, everything from personal trainer to golf fitness instructor to water aerobics to nutrition and sports nutrition. If you've been thinking about going into sports and fitness instructor arena, I highly suggest you check out the American Sports and Fitness Association. There's a link on my website, confidencethroughhealth.com. You can go there to look at other episodes of the website, but also check out their information. It'll link to their website, and you can check out more information about how to get certified as a sports and fitness instructor. Welcome back to the Confidence Through Health podcast. It's your host, Jerry Snyder. In this episode, I had the pleasure of speaking with Tayler Sanders. She is a cardiac care nurse in the Plano, Texas area. She is in a trauma hospital, and we talked about what she sees on a day in and day out basis, what we need to do as a society, as a person, as an individual for prevention of cardiac disease, prevention of chronic disease, and preventing ourselves from being in her care. Because ideally, you really don't want to be in her care as a trauma nurse in the cardiac care unit. We talk about the different diet plans and what a proper healthy diet plan looks like. We talk about exercise and the amount that you need. And we talk about the need to go to the doctor, the need to see your physician on a regular basis to help with that prevention plan. So I think you'll enjoy this. I think it'll be helpful for anybody that's potentially on that borderline unhealthy and not sure what to do. And I found it motivating to stay on the healthy path. So share this with anyone that you care about that is heading down that unhealthy path. And if it's your first time here, we thank you for jumping on and listening to us. And if you would send this to somebody, subscribe on Apple Podcast or Spotify. So you'll hear all our future episodes come on, and send us a review or a comment or a question. I'm happy to address those in future episodes and answer any questions anybody has about their health. But without further ado, I bring you Tayler Sanders. So this week I have Tayler Sanders on the Confidence Through Health podcast. So thank you, Tayler, for being a guest.
Oh, thank you so much for having me, Jerry.
So before we get into sort of the real reason why I wanted to bring you on with, your background in nursing and specifically working with people who are dealing with sort of the chronic disease part of things. Tell us a little bit about who you are, where you got to helping people in what you're doing.
Sure. So like you said, my name's Tayler. I work in the cardiac specialty. I'm a registered nurse at a level 1 trauma hospital. So I'm surrounded by brilliant people and fantastic resources, which is a great environment to keep learning and growing. And I'm constantly on the search for more knowledge and, why do we do things? How do we do it better? How can we improve that? And how do we relay that to the public so that they're more educated and they can make conscious decisions to improve their health?
Right.
I chose the heart specialty because it is critical, I guess you could say, in your body.
Right.
And, you can't go far without it.
Yeah.
And there are some really simple things you can do to help your heart be healthy, and what you do to your heart, you're doing to the rest of your body, and the rest of your body impacts your heart. So everything's very integrated. Right.
Very true. And my degree's in exercise physiology, so I've got some of the cardiac side of things as well. So in your daily, working with people, like you said, the heart is an important piece of the body. So what is it about sort of what we're doing that's wrong in leading people to be, cardiac problems as far as they're having chronic disease or whatever. Like, what is it that we're doing wrong, and what is it, or what should we be doing to replace that?
Sure. So there's several risk factors that really contribute to cardiovascular disease, and they're all pretty obvious. And I think everyone is looking for a secret key and a secret pill to take.
Right.
So the bad news is they're obvious and there's not necessarily secret, but the good news is it's easier said than done, but there are things you can do to help. So one is your diet.
Yeah.
The American Cardiology College and the American Heart Association say, focus on a veggie, a fruit, a nut, a fish, legumes, whole grain, focus on that kind of diet. The second thing is tobacco. I know that's really hard to quit, but it makes such a difference. The third thing is exercise. Then you have hypertension, cholesterol, and diabetes. So, even if you have some of those things like diabetes or hypertension, you can do things to make yourself healthier so that you don't have this cardiac problem.
Right. Well, and one of the things, of course, you mentioned tobacco, which is also, when you look at cancer, that's a big thing for cancer as well. So it's just a bad thing all the way around. And it's funny because sometimes I forget to mention that to people because, you get stuck in a routine or you get stuck in a way and it's like, oh yeah, don't do that part of it as well. But I saw something that is interesting about that tobacco is soon going to be no longer the number one risk factor for cancer, that it's going to be diet, which is really scary. And so we'll talk about, like you mentioned, some of the things that we're supposed to have in a diet. So is that something we should be doing once a week, once a day, how should we be framing like our normal diet?
It's hard to kind of put that on people, but some people say, I eat meat once a week because that is my treat and I really need my chicken fried steak or something, but that's a lifestyle you want to head towards, it helps. It's just that modifiable risk factor that you can really control.
Right. Well, and one of the things that I like to tell people is that it's not necessarily also what you eat, but how it's prepared that plays a big part in it. You can take the healthiest food and make it unhealthy by how you prepare it.
That is true. Mm-hmm.
Or what you put on top of it, so that you can eat it. So, so in regards to why like in the body, why is it a plant-based diet, where you're really focused on whether it's 80% or 90% or, that higher plant-based diet, why is that better for your body than, the good old fashioned meat and potatoes?
It has a lot to do with it, how it's broken down in the body and, we won't get into the science of all that, but you are what you eat and your body can only work with what you put into it, so when you're talking about like the coronary arteries, which are the arteries in your heart that feed your heart muscle. So even your heart needs blood. So whenever you are eating foods that have a lot of that cholesterol, you're supplying your body with cholesterol to line those arteries, and then that sets off a whole reaction where your body recognizes this is foreign and it's trying to cover it up. It gets bigger and then it ruptures and all of a sudden now you're having a heart attack, so it's all about what you're putting into your body. Yeah.
And one of the things that when it comes to like that plaque around, the arteries, the cholesterol that builds up is like, is it true that if you eat more plants and then you're sort of, for lack of better terms, you're sort of cleaning out the pipes because it sort of is like the rotor-rooter that goes through and cleans everything out?
Well, you're not supplying your body with more stuff to hurt it,
Right.
There's also been several studies that have shown that your body is more inflammatory when you're eating meat. Mm-hmm. And then that's also a huge part of that process with that plaque is the inflammatory process as well.
Right. And that's something that whether or not, like, you can't always tell unless you actually have a heart attack. Like you can't, like sit there and go, oh, my arteries are 30% clogged. Like you can't feel that, right? But you can feel the inflammation. You can feel the inflammation, right?
Yeah, so usually when people feel it, it's their heart's not getting enough oxygen. They're not getting enough blood.
Right.
And then that pain is the result of that. And that's usually when people go to the doctor or the hospital and say, hey, I'm having this chest tightness or this jaw pain or my arm, And
Yeah.
then, we can do different studies, but they are invasive to see how, like, what percentage it's blocked.
Mm-hmm.
But that's not something you would really necessarily want to go do for fun.
Right. Yeah. No. Yeah. The less people that are cutting on you and cutting you open, the better.
Yes.
Most of the time. Most of the time.
Yes.
So a lot of people think that they can live however they want, and they'll just rely on the doctor to do the simple fix, whether it's a medication or, like I said, a surgery. But that's not always the best solution, right?
It's not a great idea.
Yeah.
There are things we can do medically with medication. We can try to help lower your cholesterol. We can go in and clean out your arteries. If there's several arteries that are blocked, we can do surgery for it. Mm-hmm. But once you do it once you have one of those episodes, you're at a higher risk for having another episode.
Right.
And if your coronary arteries are full of plaque, well, so are the rest of your arteries. You're going to have problems with your legs and your arms, and it's going to be systemic. It's
Right.
not just your heart, it's going to be everywhere else. So the best method is prevention.
Yeah.
Make yourself healthy so you don't have to do that. I don't like that being everybody's first plan. Well, I'm going to eat this, and if I need to go get a calf done, I'll go get the calf done. And
right.
You don't want to do that. It's a temporary fix for a bigger problem.
Right. Well, and one of the things that and I've told people this multiple times, is one of the things that I saw when COVID first hit, and the news media was trying to figure out, okay, let's talk about potential vaccines. This was early on, and so that was still way down in the future. But let's talk about medications that they're treating with. And I remember Dr. Fauci even said in one of the press conferences, he said, well, you remember that every medication has some level of toxicity to it. So just because there's a medication you can take to make yourself feel better, it's not necessarily the best option for you. The best option for you is, like you said, to be preventative, right?
Yes.
So
yes.
Do those things, like a good diet and exercise, every so often.
Every medication is going to have side effects,
right?
And there's not usually a way to mitigate those side effects. It's just, that's the price you have to pay. And for some people, they would rather pay the price.
Right.
And other people wouldn't. But the best way is definitely primary prevention, just eating healthy and exercising, doing your part to try to reduce your risks.
Right. So when it comes to exercise, so what's the recommended amount of exercise, not necessarily for the average person, but for, say, somebody that's already not healthy, and they're like, okay, I'm at that crossroads. Either I do something or I'm looking at surgery in, 3 months or 6 months. And so go ahead.
Usually if you are at the point where you might need surgery, your doctor will recommend a rehab program, depending on how extreme you are, all the way up to the point where you are in a specific medical facility where you strap on an EKG and we watch your rhythm while you are exercising, so we can stop you if it gets unhealthy or unsafe.
Right.
But the across the board kind of to reduce your risk is 150 minutes a week at least of moderate exercise, or at least 75 minutes a week of vigorous exercise.
Okay. And so what's the easy way to tell the difference between the two, moderate and vigorous?
Unfortunately, I think a lot of people are considering moderate exercise vigorous exercise. Right. So that's kind of hard. But, walking or biking is, it's the moderate. When you take that a step further, you're running, you're doing, very quick hills, biking. Right. Ballroom dancing, for some reason, is in the vigorous category, which I thought was funny when I had learned that originally. So it's really getting your heart rate up. Your heart is a muscle. You're strengthening your muscle when you're doing the cardiac exercises. So it's really getting your heart rate up and building that endurance, making your heart stronger.
Right. And as much as some people don't like to sweat, like sweat is a good indicator of the level of your exercise, right?
Yes, yes. Unfortunately, you are going to have to get sweaty.
Yep, exactly. Um, so I want to talk about, like, there's a lot of people, but mainly guys that fall into this category here that I think is they just don't want to go to the doctor, and it's not even that, like, I'll go to the doctor when I have a problem and they can fix it, like we talked about, but more they're either scared or they just don't want to be told what they have to do. And so what would you say to somebody about, like, the importance of regular doctor's visits, for their health now, but also for longevity standpoint?
Yes, yes. I actually get a lot of patients who waited way too long,
Mm-hmm.
and it was catastrophic. It does matter getting, assistance when you need it.
Right.
If you feel like you might be having a heart attack, go to the hospital. Worst case scenario, they say, oh, it's indigestion, and then you can just go on home,
Right.
And so what we always in the medical field, we always balance the risk versus benefit. And so I think when I'm making a decision, what's the worst case scenario either way? So
Mm-hmm.
if I might be having a heart attack, worst case scenario of me going to the hospital is they say, oh, you're not, go home. But worst case scenario of me not going to the hospital is I am having a heart attack and parts of my heart muscle dies.
Right.
And sometimes that's lethal.
Yeah.
So I would always suggest, go call your doctor if nothing else and explain what's going on. Usually if you're on a medication, like a cholesterol lowering medication, usually it's a statin, you have follow-up appointments to make sure that you're reaching those cholesterol goals. But it is important to follow up and check up with your doctor and make sure you're on the right path, and anytime you do that, they can give you, they can make sure to steer you in the right direction and answer all of your questions.
Right. And that's important also from, like, the standpoint of when they give you a medication, you always take it all the way to the end of it.
Oh gosh, yes.
It's one of those things, like, just because you start feeling better, that doesn't mean you're actually better.
Yes. I read something the other day that said, if you're trying to get a hold of a nurse and they're not responding, just text them a message and said, I'm feeling better, so I quit after 3 days out of the 5 of my antibiotics. You will get an answer. And I was like, oh, right. Yes, you would.
Right. Oh my gosh.
Yes, you take your medicine as prescribed.
Yep. So what are 3 simple steps that someone can take to change their diet? Like, what are 3 simple things? Because I know that's I deal with that a lot with people is, like, oh, I can't give up this or I can't give up that. And I'm like, well, what are 3 simple things that they can do?
Sure. So diet, I would say get rid of sodas. Mm-hmm. That's usually an easy thing you can replace with something else. You can drink tea instead, drink coffee, drink a flavored water. That's something that you can kind of slowly replace, and it's very helpful, and then I would kind of always suggest looking for maybe just a slightly healthier option. If you're really craving a burger, consider a veggie burger. They taste really good. They're full of flavor, and I'm sure people don't agree all the time, but just look for healthier options. If you're going to go for cheese fries, maybe this time just do fries. Or if you were going to get, a double sundae, try to get a single sundae. It's the small things that kind of slowly add up that can really be helpful. And, we always say, stay away from trans fats, red meats, processed meats, refined carbs. So just trying to find a substitute for those things would be really helpful. Right. And I don't think anyone can expect somebody to completely change their diet overnight. I think it is going to be a slow process, and you just got to do it one thing at a time, but when you try to keep in mind that this is your life and your health that you're working for, then it might be a little bit more motivating to stay on the train.
Right. Yep. No, I was actually listening to a podcast today, and they said, and it's a neuroscientist, and she was talking about, from a clinical standpoint, dealing with people on behaviors. And she said, the for some reason, and she said she did the research and she couldn't find anything where research supported the 21 days to break a habit or create a habit. And she said it's actually like 3 or 4 times longer than that to actually create the habit. So I totally agree with you on making those small little changes, because if you try and do it like all in one day or all in one week, then you might be successful for a very short time, but it's probably going to backfire.
Yeah, and it's very overwhelming. I work in the hospital, so it's a lot of just hospital teaching. And when you discharge, we give you this packet of information.
Mm-hmm.
And a lot of people read it and think, oh my God, this is too high of a mountain. I'm just gonna, well, I survived. I guess I'll be fine, and they just kind of put that out of their mind. So what I tell my patients when they're leaving, just pick one or two things and do that. And then pick one or two things after that. And, just climb the mountain a little bit at a time, because there's just no way you could possibly retain all the information and make all those changes, but just a little bit at a time is better than nothing.
Yeah. And then going to your follow-up appointments and making sure that you're doing what you're supposed to do.
And take your medication.
Right. So, talking about the patients that you see in the hospital, is there a trend one way or the other of like how patients are changing as far as what they look like coming in? Are they all coming in with this? And granted, minus the COVID that we've gone through with, that being a big thing. But as far as like, is obesity driving a bunch of what we see in the hospitals?
Yes, most of my patients and in the cardiac floors are obese. That does have a lot to play with it. That diet and exercise kind of transfers to a bunch of other risk factors, hypertension, those two things. The diet and exercise will help that. Diabetes, they will help that as well. The cholesterol will help that. So diet and exercise really is at a huge core of a bunch of those risk factors that you can help. But it is really hard for a lot of people to commit to that and to stay on that. So I do see a large number of people that are overweight, and that really does contribute to that problem. If you have fat in your body, you have fat in your arteries. Right.
And so, and it's not necessarily something that I know a lot of people, and I haven't heard about it as much lately, but, they'll go have surgery to remove fat, or they'll, bariatric surgery or whatever but that's not really, from a chronic standpoint, it's not really helping, right?
No, they took the fat off of your belly or your thighs or something, but there's still fat in your arteries, and that's the stuff that'll kill you.
Right.
It may not be a cosmetic change once when you get those things fixed, as you would with your tummy tuck or something. But that is, you still have those lifestyle habits. You still have the problems with your arteries. So it is just a cosmetic fix. It's not really a long-term fix for your health.
Right. And you mentioned earlier that the rate or the risk factor increases after you have an actual heart issue. You have something happen. So the big goal is to prevent anything from happening, right?
Yes.
So what happens if you do have that? Like, is it just, okay, well now I'm set, I'm done. It's just going to continue to happen, or are there things we can do?
Yeah. And a lot of times people's heart attack scares them, and they realize I cannot live the way I live. I'm not going to do this anymore. I really need you to just tell me honestly, what do I need to do to make this not happen again? And we give them their cholesterol lowering medications. We talk about their risk factors, the ones that are modifiable and the ones that aren't. If you have a family history, there's nothing you can do about that. Your family history is going to stay. But anything you can change, modifiable risk factor, how do you modify those? How do you get them better with each one of them, and how much can that contribute? And there's a lot of people that I don't see come back, and so it's unfortunate that it took something that scary to do something about it. But, all the family that they reached and that saw their experience, hopefully really took that information and is trying to make themselves healthier as well.
Right. And I had a doctor on early on in when COVID hit. He was a cardiologist, and he mentioned about COVID being respiratory, but also having some issues with the heart and having some effects on the heart. So is that something that y'all, this was back in April, so I haven't talked to anybody about that since then. So is that something that is that something being talked about in the hospital?
I've heard people say that it might be a COVID induced whatnot, with different things. I personally haven't read any studies on it, so I don't want to speak to something that I don't know for a fact, and I'm sure that's a lot of those things we're not going to know until we see a bunch of data and then we're able to study it. But I do hear people say, oh, this could be a COVID induced, whatever is happening.
Right. Because as we've all heard, COVID is worse on people that have comorbidities and already have health issues going on. And so again, one more reason to be in that preventable stage.
Yes.
When you're looking at your health.
Yeah. With any problem you have, with any sickness, it is going to hit you harder if you have other risk factors, if you have other diseases, other comorbidities. It is definitely to your benefit to live a healthy life so your body's prepared for whatever comes at it.
Right. So what do you see is like do you see the future being like we're starting to get it and starting to change? Or is it still, are we still from the healthy standpoint, are we still fighting a huge uphill battle?
Sure. So I think, with different risk factors, I see different things. Tobacco use has gone down tremendously. Mm-hmm. And that's fantastic because it really, really does cause a lot of problems with your heart and with everything else.
Right.
Obesity is an issue. More and more people are overweight and obese. But I think there is, on the whole, the trend, cardiovascular disease has gotten a little bit better with our knowledge, with our drugs that we have, with our education. The more educated you are on something, the more you can combat it. Mm-hmm. And that's what you see with this several decades of the trend getting better just because we're armed more appropriately.
Right.
But yeah, obesity is getting worse. But at least the tobacco is getting better. Right. So, you got to work on it. Diabetes trends are trending upwards with a bunch of studies that we see. And that's a huge risk factor as well.
Yeah. So with obesity, for the average person who doesn't go to the doctor, who may be putting on that typical 5 to 10 pounds a year, that I think a lot of people are in that situation. What, and they either don't see it or they ignore it, or, they don't want to see it, or maybe they do, but, they blow it off or they write it off for some other reason. So what classifies the obesity level? What are we talking about? Weight wise, the average person?
Sure. So, it's hard to say because I work with sick people. Mm-hmm. So my vision is going to be skewed. Right. But yeah, even, walking around, looking around, I have nurse goggles. I'm cursed now that sure. I've, been, since I've graduated, and I see people and I think, I wonder if they know they have heart failure.
Right.
So, looking around and I just notice people's health, and, I do think there are more overweight people, and, and it's unfortunate because our society is very conducive to that. Right. Everybody's lifestyle is, drive the car to work because you have a fancy car, do your Zumba class, but it might be more of a social thing. Right. Whenever you hang out with anybody, it always revolves around food. Mm-hmm. Our society really is conducive to that kind of lifestyle that kind of promotes being overweight. And you have to learn how to substitute things.
Right. Yep. And obesity is really from it's 30, is it 30% for the BMI? Mm-hmm. Yeah. And so I've seen studies that it's at somewhere in the 35% of Americans, creeping up towards 40%, which is scary. Considering that the average, you should be somewhere in the low 20s with the BMI, and to be, that far off, it really does say that there's more issues than just, I'm not eating or I'm not exercising properly. I think there's usually more issues going on. So can you speak to maybe the support system for people that you see that are sick? Is are they not is it not a healthy support system, like for the general, that you see?
So, we ask a bunch of people, what kind of support system do you have? And this is especially important when we do open heart surgery, because you need a lot of support for an
Right.
open heart surgery. Even once we get you past that acute stage and you have chest tubes and pacing wires and everything else, even when you go home, you can't do a lot of things because we have to put your sternum back together, your chest bone back together. And for that to heal, you can't push or pull or, forward or back. You can't reach behind you.
Right.
You can't put your arms over your head. It's a lot, so we ask everybody about their support system. But a lot of times, I haven't really asked anybody, do you have a support system to lose weight? We just kind of talk about things that they can do. And everybody knows, when I bring it up and I start saying, okay, let's talk about some healthy food choices.
Mm-hmm.
Everyone already says, well, I know, I will, but
Right.
what's a cheeseburger going to do? And I'm like, well, yes, but you're also here.
Yeah.
So we do need to talk about these things, but it's hard to talk about, it's kind of embarrassing.
Mm-hmm.
It's a little shameful because, you shouldn't have, but you want to, and you're tired. And, so it's a really hard balance of, people are people, and they have coping mechanisms versus, hey, you really got to get serious with this if you want to be healthy. But a problem we see sometimes is, if you're obese, you have problems healing.
Right.
There's a lot of problems around procedures and surgeries that if we think you can't heal, then we can't do the surgery.
Right.
You can't stitch fat layers together. They won't heal back together. So if you have a lot of that, you're coming across a problem now where we can't even do a procedure because you might not heal from it. And that's going to cause more problems. I think that's what really gets some people when their fallback plan is, well, I'll just go in and they'll just clean out the arteries for me. But when you get to a spot where we're saying, hey, we can't do this because you're not going to be able to heal from these incisions, then you're in a whole nother world of problems.
Oh my gosh. Yes. I hadn't even realized that was becoming an issue. That's scary. Because then you face infections and all those other things, right? If you can't heal properly, you've got all that, a whole nother gamut worth of things that you don't want to go down.
Yes.
Yeah. So, we talked a lot about, like the needing to be in the preventable stage and needing to do all that. So what do you have what's your best motivating thing to tell someone that helps the light bulb go off?
Usually it's just being very honest. I think a lot of times people kind of tiptoe around it. And, we say, just, got to be healthy if you want to, have a good life. And that's easy to kind of sweep under the rug. But, for somebody that this literally could be life and death, just being honest with them and say, hey, if you continue down this road, this is what lies ahead of you.
Right.
Do you want to meet your grandchildren? Do you want to see your child walk across the graduation stage at college? What are your lifelong goals? What do you want to do? Do you want to travel when you're, when you retire?
Mm-hmm.
And, of course, everybody says yes to all those things. And I say, okay, well, how are you going to travel if you have to be here in case you have a heart attack?
Right.
What are you going to do if you're in New Zealand and you have a heart attack and you don't have your doctors, you don't have your support system here?
Right.
And that usually is kind of a light bulb of, I do want to walk my daughter down the aisle, and, I do want to see my grandchildren, and I do want to travel, and that kind of puts it in a little bit more perspective.
Mm-hmm.
Because like I said, the diet and exercise are really hard things to kind of get on board for. Once you're on board, usually people are good to go, and they really, really, they feel better, they look better, they're healthier, they live great lives, they have more energy.
Right.
It's just getting on the boat. That's the hard part.
Right. And mentioning all those things, one of the things that popped in my head was, of course, the cost of, and I get that a lot is, it's so expensive to eat healthy. But it's a lot easier to do that when you know what the cost is going to be down the road if you don't do it.
Oh, yeah. It's very expensive. Hospitals are expensive,
Yeah.
medications are expensive, surgeons are expensive. It's definitely cheaper to eat healthy.
Yeah. I mean, I know a few people that have had bypass surgery, in the last couple of years. And I remember one of them was like, wait a minute, the hospital wanted this much. And then the doctor sent me a bill. Like, I thought they were together. And I'm like, oh, no. Like, and then you'll get another bill from this place and you'll get another bill from this place. And then you got to pay for your medication. And then and it adds up to a lot of money.
Really does.
Even if you have really good insurance.
Mm-hmm.
And so it's when you take a look at that, and sometimes unfortunately it's too late, but when you take that, I think that's the lesson we need to learn, is that it's much better for you to pay an extra $2 a meal for the healthy food than it is to pay that big chunk all at the end.
Certainly.
Because then that could wipe out. If you want it, like you ask somebody, like, do you want to travel when you retire? Well, that could be all of your retirement.
Oh yeah.
Very easily. So, well, I'm so thankful that you were able to connect with me and we were able to do this, because I think this has been very helpful for people. And I would like to ask you, what's your idea or definition? And we sort of talked about this a little bit, I'm sure, but of a healthy lifestyle, like your personal idea or vision of that for you.
For me, I think it's all about, your happiness, and not necessarily a gluttonous happiness, but just like a pure happiness. For me, being outside and doing things, biking, swimming, running, that makes me happy. I have more energy. I'm tan. I feel better. I look better. Eating healthy makes me feel good. My sister always says, the more I eat, the hungrier I am. If I fast for a day, I'm just not hungry and I have so much more energy. But the second, I eat whatever other food, God, I'm just so hungry all the time. I wake up hungry. I go to bed hungry,
right.
And it's a vicious cycle, and just indulging in healthy things is happy. A lot of people say, sometimes, my chicken wings or whatever just make me happy. My cake makes me happy.
Right.
Well, yeah, but other things can make you happy too,
Right. And those things will make you happy in the moment, but not necessarily long term. Not granted, there's not anything wrong with it every now and then, but it's when we get into the lifestyle of cake every day, or those types of foods every day, the fried foods every day, that's when it's the bad side of things.
Honestly, it's about moderation. Yeah. Have a cake for your birthday, right. Eat pizza on a movie night with your family. As long as you're not doing that stuff every day, it's okay. Lay it on the couch and have a relaxed day.
Right.
But don't do that every day instead of doing your exercising. Moderation is the key.
Yep. I agree. Well, thank you again so much for being on.
Thank you so much for having me. I had a great time.
Thanks for checking out the All in Health and Wellness Confidence Through Health podcast. Our goal is to use health as a conduit to help you reach your goals in life.
A little lighter than me. I'm about to black out. Her grip is getting tighter on me. I think I like it deep inside. I feel the fire in me. She like the milky, see me creaming to the coffee in me. She got soul in her sway.